Hey everybody, Dr. Tucker here from Active Family and Sports Chiropractic. So welcome back to our series on what acupuncture can help with. So we've been talking about overall general health and wellness questions, but probably one of the biggest things that we see here in our office, I don't think I've talked about that much. So can acupuncture help my neck pain? And this can go all the way down the spine. Can acupuncture help my back pain? Anything spine, joint related, things like that, the short answer is yes. So what is going on when we are putting in these acupuncture needles? So a few different things are happening. When you experience pain somewhere that's musculoskeletal, there's a couple different sources of pain that can be coming from. It can be coming from the joints themselves, it can be coming from inflammation, it can be coming from the muscle strain or tension or even a spasm that's going on. So there's a couple different pain generators that can be happening when you are experiencing musculoskeletal and posture issues. So with acupuncture, what we can do is try to address some of that both chemical and mechanical pain that's going on and the inflammation that happens in the muscles and in the joints itself. So I see this a lot. People, posture, it's not that great these days. I bet right now, if you're watching me on your mobile phone, that you're probably looking down. So as a society overall, we're starting to lose that natural curve in our neck. I worry about kids and heavy backpacks that they have to carry. That affects posture. Depending on how you sit at your desk, if your desk is facing kind of catty-cornered one way or the other, or you're more dominant on one side or the other, that can start to develop pain and tension along the muscles of the neck and start to weaken the posture muscles in the back. So what we can do with acupuncture is, of course, on the chiropractic side of our office, we're doing adjustments. We are assessing that joint motion and just the overall motion within everything, and restoring proper motion and working on those postural muscles. But sometimes we really need to get over that whole pain cycle that's happening. So what we do with acupuncture needles is I do evaluate the whole body when we're looking for an acupuncture evaluation. So there are certain points that historically have been related back to helping other areas of the body, but they're not necessarily in the area that has a pain. So with neck pain, we do needle the neck and the upper back and usually across the shoulders, but sometimes we can do some points down in the hands as well, or further down the spine. That can just help with overall tension and everything like that. So hey Alicia, I see you on here. Yes, backpacks, kids' backpacks, very heavy. Yeah, we had a kid in here just about a week ago. Parents brought them in with the backpack, and Dr. Miller helped them, adjust it and said, well, can this book not go? And can this book not go? So it happens, and sometimes we kind of have to re-engineer those things and sort of come up with a different solution. Like, do you have to carry this book every day or not? Kids' backpacks, very heavy, and apparently they don't really use their lockers anymore. And they won't allow rollers. Yeah. I don't know why. I don't have school-age kids yet, but that seems like it would be a logical thing to do. So anyways, when thinking about acupuncture, I see this a lot where we have one-sided neck pain. Sometimes it can spur off and start to cause headaches that wrap around one side of the head, or people can have tension, up in the sinuses, that sort of thing. I'm seeing a lot of people for sinus and allergy issues right now, because when we needle around the face, it can really just help to loosen everything up and allow them to breathe a little bit better. So acupuncture, again, the type that I do is painless. You probably feel that first little prick when the needle goes in, but you're not feeling it the whole time. Here's a sample of the needles there. Like, they're gigantic on the screen, but they're pretty small, compared to the face there. So depending on what angle we're going in, they may not go in this whole entire length. I may needle right under the skin and along the muscle fibers to try to help to relax it, or it may do something a little bit more perpendicular to the muscle or to the joint itself. So usually don't feel it at all. Positioning, I do have tables that people lay down on. Sometimes I have people lay on their side. Sometimes they lay face down. Sometimes we put them in a reclined seated position, like in a massage chair, because that'll allow me to get all the way down the spine and not have that tension of having to hold the head up at all. So but we see some really great results. Pain relief is usually for most people, happens that same day. Sometimes it's a little bit tricky, and it takes a few sessions or it takes a few days for you to realize, hey, I'm not having as many flare-ups as I was having with the neck pain, or not having the same type of headaches or the same intensity and that sort of thing. So, all right, let me see here. So I think that's about all I have on neck pain. So posture, again, is very important. Addressing ergonomics at the desk. Not looking down a lot on cell phone use and stuff like that. Getting good range of motion in. But if it hurts, that's a warning sign from the body that it needs help, or it needs something different to happen. And so you should really never ignore any type of pain that's going on in the body. In the use of medications, you really have to be careful, because any type of medication that you're going to take is going to have an effect on your liver and on your kidneys, and you don't want to become dependent on something like that. So if neck pain is affecting your sleep, anything like that, you definitely need to get it checked out, and medications are not going to get down to that root cause. So we need to really balance the body, get things back to where they need to be, and be out of pain so it doesn't become a chronic issue. So hope everybody has a good evening, and let me know if you have any questions on anything.